Hey, in this video I am going to teach you how to do an auto-agglutination test. So this is a very useful test in clinical immunology. This test is commonly done in patients that are suspected for immune-mediated hemolytic anemia. So auto-agglutination test is a qualitative test which can be performed in clinical setup and in small laboratories. This procedure involves 3 steps. First step is serum separation and RBC washing. Step 2 is incubation, where patient's RBC are incubated with patient's serum. Step 3, examination under microscope. Materials required: patient's blood and serum collected in EDTA and serum separation tube. 0.9% normal saline. You need to have a centrifuge, water bath which is maintained at 37 degrees Celsius, and some syringe, clean test tubes, glass slides, microscope, etc. So now on, I am going to show you how I am going to process the samples for auto-agglutination test. So I am going to take the plain test tube and start writing the patient's name. So I am going to add 200 microliter of patient's blood into this plain tube. To the patient RBCs, now I am going to add 4.8 ml of normal saline. Now you need to invert the sample for several times. Now I am going to centrifuge it for 1 minute. I have centrifuged the RBCs. We need to discard the supernatant. To this RBCs, I am again going to add 4.8 ml of normal saline. So after mixing thoroughly, we can start with centrifugation. So centrifugation is done. I am again going to discard the supernatant. Let's proceed with centrifugation. So final centrifugation is done. I am going to decant the supernatant and resuspend with normal saline. So we will be using this RBC for auto-agglutination test. This is the patient serum which I separated in the beginning. You can see how hemolyzed the serum is. Now I am going to mix patient RBCs with patient serum, and I will be incubating it for 20 to 30 minutes at 37 degrees Celsius. So to begin with, mix the RBCs properly and then take 100 microliter pipette and pipette out 100 microliter and add it to the centrifugation tube. I am going to add 200 microliter of patient's blood. Discard the tips and do the same with serum. Add 200 microliter of patient serum. Now this tube is going to sit into the incubator. I am setting the timer for 20 minutes. You should also necessarily incubate patients' blood and serum at 4 degrees Celsius to rule out agglutination, especially it happens in cold agglutination. While the sample is in incubation, you can as well do a saline agglutination test. Take a clean glass slide, add 1 drop of patient's RBCs and 2 drops of normal saline. And you can check it under microscope. Incubation is over. Now I am going to centrifuge it for 1 minute and I will come back. Centrifugation is over. You can check the supernatant for hemolysis. In my case, I can't do that because my serum was already hemolyzed. That's okay. Now I am going to decant the supernatant and mix the sediment and place it on the slide, and I am going to examine in the microscope. So this sample doesn't really concern me because I don't see any signs of agglutination here. The RBCs are really free, but you can see some star-shaped RBCs and some RBCs that are small in size. It's probably because of anemic changes. So this is how the microscopy of sample that was incubated at 4 degrees Celsius looks like, and you to the right you can see aggregates of RBCs. So a negative autoagglutination test doesn't rule out IMHA. You always need to confirm it with Coombs test. It can also come negative when autoantibodies are really very low in number. So if you are suspecting for IMHA, there are so many other things which you can check. For example, you can do a blood smear and check for number of spirocytes per high power field. You can also estimate RPI index, which is called as reticulocyte production index, which I will try to cover it in my next video. But with that, you can also always classify anemia, whether it is non-regenerative, poorly regenerative, or if the anemia is due to hemolysis or hemorrhage. Hope this video was very informative. Make sure you subscribe to my channel for more such videos. I'll see you in next video with another topic. Till then, take care and bye.